interest in cardiology and used to work in a hospital doing cardiology. So it is a kind of a background of mine. And I wanted to do a topic on kind of how to spot the signs of a heart attack. Just to kind of give you some education. It's quite a difficult topic to kind of go through, but I'll try and hopefully make it super simple, as simple as I can. Just to remind you that the webinar is being recorded. So if you prefer your face or your name not to appear, you can change your name and you can just turn off your video camera. It will be uploaded on the website, so we'll send out links so that if you wanted to share it with family or friends or just watch it again, then that's absolutely fine. It's not a problem whatsoever. What I am going to hopefully do is just share my screen and then explain those things. If it's kind of 30 to 40 minutes of me talking, for me it gets almost quite boring. And the more interaction that I can get from you guys, the better. So there is the raise the hand function. So you'll see in the top of the screen, you'll see a hand and you can just click on that. And then towards the end, I can ask you a question. There's also a little speech bubble just next to it, where if you click on that, you can actually write a question for me and then I can go over that. Listen, it's a difficult topic and hopefully I'll try and explain things and hopefully I'll be able to, I guess, educate you a little bit more about heart disease. And you know, what I'd love is also at the end, if you could give me some feedback and you know, we'll send out some sort of feedback so that you, if you've enjoyed it, then great. If there's something you would have preferred differently, then again, you know, it's useful for me to try and hopefully make improvements so that we can do other sessions and what we can learn from it. So without further ado, I think, you know, it's past 1 o'clock now, so hopefully a few people might join, but I'll just continue on. Is that all okay with everyone? Yeah, fantastic, great. I will share my screen and hopefully you'll see, you should see hopefully you should see this and the presentation. So Divyesh, can you tell me if that's on presenter view or is it on the right view? This is online. Goes up, down. Divyesh, are you there? Can you just check on? I'm just gonna put it on to, because I did it on presenter view and then I think it goes to swap presenter view. That's it. I think it was right. Yeah. That's it. Perfect. Okay. Okay. Hopefully you all can see my screen, which is a screen where I've just done a very short presentation and hopefully it will help kind of go through some of these topics, some of the topic that I wanted to cover. So the kind of the topic today is really how to spot the signs of a heart attack and talk a little bit about heart disease and kind of just to make you aware of some of the things. So first thing is, unfortunately, there are some medical terms that some of you might be familiar with, some of you might not. So one of them is the term coronary heart disease, and the word coronary just means the heart. So it's a medical term that often you might see. Some people might even use the term ischemic heart disease. Both of them are interchangeable, and actually all it means is just disease of the arteries of the heart. Some of you would have heard the term angina, and angina is the term used to describe the most common symptom of heart disease, and we'll come on to that in a second. And there is also a term in the medical industry that we call a myocardial infarction, and that is just a medical term for a heart attack. Both are interchangeable. One's just a medical term, and the normal term that we would use is just a heart attack. So you might hear people talk about those things, but hopefully I've broken that down for you a little bit. So signs and symptoms. So heart disease can be, in the vast majority, a classical type of symptom, and often one describes it as a discomfort in the center of the chest, and that can last for a few minutes and can reoccur. That pain often people describe as a heaviness or a tight band around the chest sometimes, and that pain is usually central or slightly on the left, and can radiate and move up to the neck or the jaws, and sometimes even down the arm. You know, that's pretty classical symptoms. This is a kind of hopefully a graphic of it where you know it's almost feels like a constriction or a kind of some people might even say it feels like a heaviness. And if there's anyone in the webinar who's had a heart attack at all, they might have had the same symptoms, or might have had different, and I'll come on to that in a second. But the heaviness, you know, some people even say that, you know, they feel like something's sitting on my chest. Sometimes they'll say it's like a heaviness, or you know, like I said, like a tight band and a squeezing type pain. Now, excuse me. In the elderly, or specifically in diabetic patients, they can often present with heart problems in a different way. So specifically, they may not even get chest pain. So if you're a diabetic patient, for example, you might never get chest pain, but you might just feel short of breath when you walk. You might feel like your heart is racing, and that's a medical term called tachycardia, and that just simply means your heart is racing. You might feel sickly or want to vomit. You might get sweaty or clammy, or you might have strange chest pains, and they might not be the classical chest pains that you would get if you're not a diabetic. So because diabetes can affect the nerves in our body, sometimes in our chest, pain can occur with diabetic patients who may not present with heaviness in their chest or a tight band. They might just get an intermittent kind of sharp stabbing pain. I would always, if you're a diabetic or you have relatives that are diabetic and they are complaining of chest pain, I would always be very, very suspicious and really get them to see us as a GP or their own GP. Kind of just because we can investigate it and then hopefully take it further. Angina versus a heart attack. So angina, we said, is the most common symptom. Now, angina is the same type of symptom, so it's that heaviness that someone might have, but it often occurs on physical activity or stress. It might occur if you're in a very cold place. Sometimes even after a large meal, but the pain usually lasts only for 3 to 5 minutes, and it can be relieved by rest or medication, such as some people might have a red spray that they use, people with heart disease themselves. Heart attacks are more severe. So the pain might be exactly the same, but it lasts for longer, usually 20 to 30 minutes. And one of the things that I would always say is if you're getting chest pain on walking, that indicates there might be something wrong. If you are getting chest pain at rest, then it would be something that we would want to know kind of the same day. And often, depending on the person, the age, the risk factors, we might be sending that patient down to the hospital just to get checked the same day. So in general, the way to think about it is angina lasts for a lot shorter period. Heart attacks last for anywhere between 20 to 30 minutes, but any chest pain that occurs at rest, we would be suspicious of. So hopefully this tries to explain things. So the red lines that you see going down and on the top of the heart are your arteries. Your heart is a muscle, and it is a pump and pumps blood around the heart. And the arteries are the thing that supply the muscle and the pump with blood and oxygen, which allows it to then move. So if you look at the diagram on the left where it says normal artery, partial block, complete block. In a normal artery, someone doesn't have any heart disease. You can see the blood just going from left to right, and there's no blockage whatsoever. If you have a partial blockage, you can see that there's a narrowing in the middle of that tube, and that would be someone who may possibly get angina or symptoms of angina and chest pain on walking. So as the heart beats faster, the heart needs to work harder, and actually there's less area for the blood to go down, and as a result that will often give chest pain. And it's the body's way of saying, hold on, I need you to slow down because I can't get I can't supply my heart with the thing that it needs to then work as it needs to work. If you get a complete blockage, that's when one might have a heart attack. Okay, hopefully that explains it, but please ask questions at the end if it doesn't make sense. I know it's not as easy to try and explain it, especially kind of over the internet, but hopefully that gives you an understanding. And again, if it doesn't make sense, please ask more questions. So the risk factors for someone having a heart attack. So someone might have high blood pressure, high cholesterol, diabetes, which is a very big one, smoking, which again is a big one, being overweight or not even doing any physical activity. All of those are risk factors that one might have and you could potentially control. Risk factors that you can't control. So these are things that actually doesn't matter, who you are, you can't control these. So this is who your family is. So whether you've had a family member, might be a parent, it might be a brother, it might be someone who has had a heart attack under the age of 60. So over the age of 60, it's much more likely for someone to have a heart attack. But under the age of 60, it does indicate that as a family member, you're at much higher risk, sorry. Age. So hopefully it makes sense that the older you are, the more likely you are to have a heart attack. Also different ethnicities. So Indian people, Pakistani people, Afro-Caribbean people generally can have a higher risk of heart disease than white or Caucasian people. And gender, and unfortunately men are more likely to have a heart attack than females. So hopefully some of you are aware of those things. How is heart disease diagnosed? Well, what we would want to do is first talk to you and understand actually what are the symptoms that you are having, and those symptoms, are they consistent with heart disease or is it not? And as some of you might know, we do one of the tests in the practice, which is an electrocardiogram or an ECG, and that is an electrical tracing of your heart to have a look at it and see how exactly the electrical activity is functioning in your heart. And that might give us indications that actually there is something that's a problem. An echocardiogram is an ultrasound of the heart, and some of you have had ultrasounds or may have had an echocardiogram, is where they put some jelly on your chest and they put a probe and they have a look, and they're having a look at the muscle and how the heart functions. And then the last one is a coronary angiogram. So that is where you would be referred to the hospital and they would inject dye into the arteries of your heart and look for those blockages and look for those narrowings to see if at all you are at risk or have any heart disease. Now, patients themselves, so one of the things that we do is we do a free health check for anyone to check if you are at risk of heart disease if you're between 40 and 74 and have no other conditions. So it's for essentially healthy people to check if they've got any risk factors like high blood pressure, high cholesterol, not people who have diabetes or heart disease or high blood pressure or high cholesterol. So it's more for healthy individuals, the NHS health check, just to try and proactively pick up people to see if what kind of risk they are at heart disease. Now, what I've done is this is a little bit more confusing, hopefully, but I'll try and spend a bit of time explaining it. So one of the tools that we use is something called the Q risk, or it's basically a risk calculator of having a heart attack. And what it says is that in the next 10 years, how likely are you to have a heart attack or a stroke? Okay, so and this is a website and it's attached here, and we can send out the link to everyone, and it will be on the webinar for you to have a look at. But the website is there. It's qrisk.org, and this is called a QRisk3 score. Now, what it does is you can put in your data, and you can put in your age, your ethnicity, your medical conditions, what your most recent blood pressure is, what your cholesterol was, what your if you've got any family history of heart disease, and all of those things, so that you can have a look and see actually what your risk is. Now, again, a thing to stress is risk is risk. It doesn't mean it's going to happen, but the idea is saying that the risk is there, and actually if there are things that we can do to try and minimize that risk, that's the best thing. So what I think a good thing to do is I've given you a few examples of patients who live in Wembley, and this is no one in particular. This is, I just put the postcode in as our practice address, and I've just put in, so on this one I've put in a 45-year-old male who's Indian, who lives in Wembley, who doesn't smoke, he has no medical history, he has a normal blood pressure and normal cholesterol. So he's had those things checked. And if you have a look, hopefully you can see it on the screen, but the yellow faces, there are 100 faces in total, and the blue ones are the ones that indicate you're at slightly higher risk. So in this patient, his risk in the next 10 years of having a heart attack is 3%. Now, no one can have a 0% risk, but the lower the better. And we would say someone is at high risk if the results is 10% or more. So what I've done is I've given different people, and I've changed some of these things with the calculator to hopefully give you an indication. So what I've done is I've gone for males, females, I've done different ethnicities, and I've taken then the most riskiest ethnicity, and then I've increased the level of kind of medical problems and their medical conditions. So the next slide, what this is again a 45-year-old male who's Indian, lives in Wembley again, he doesn't smoke, he has a normal blood pressure, normal cholesterol, but he is a diabetic. So you can see that risk has gone from 3% to nearly 7%. Okay, so it shows that actually if you're a diabetic, your risk then significantly goes up in someone of this kind of ethnicity and these types of backgrounds. And in all categories, diabetes is a very high risk factor for having a heart attack. So what I've done is I've now taken it to a 55-year-old male, and these statistics are based on national data that they have taken patients with different ethnicities and different conditions and created this risk calculator. And what you will find is that patients of a white or Caucasian background are less at risk. People of an Indian background are slightly more at risk, but Pakistani people or people from a Pakistani background are at slightly higher risk. And in someone of, let's say, 45, that risk might be between Indians and Pakistanis, it might only be 2%, but it is slightly higher. So if we look now at a 55-year-old male patient who's Pakistani, who lives in Wembley, non-smoker, a diabetic, normal blood pressure, normal cholesterol. So if you can, all I've done is I've changed it from 45 to 55. So I've made someone slightly older, and you can see his risk has gone from 7% to nearly 17%, just by adding on 10 years. I've then taken a 55-year-old female Pakistani person, and they live in Wembley, and again are a diabetic, but everything else is well controlled and they don't have any other problems. And their risk, so you can see that by being a female, you have a lower risk by about 4% nearly. But by being a male patient, you are slightly at higher risk. Okay. I've then taken the same, but gone into a male patient. So if you compare the male Caucasian compared to the male Pakistani patient, you're looking at 11% versus 17%. So there's quite a significant difference just based on your background and where you're from. If I now go back to our highest risk category, which is your male 55-year-old Pakistani patient, they live in Wembley, they're a diabetic, they don't smoke, and what I've done is given them high cholesterol. So I've said their cholesterol is high and they're a diabetic. So what I've done is said everything's the same, but I've just added on the fact that you have high cholesterol. And that risk, you can see, has gone from 17% to 23%. If we look at the next one, so I've got the same patient, 55-year-old male from Pakistan, lives in Wembley, he doesn't smoke, but now he has diabetes, high blood pressure, and high cholesterol. And you can see those, excuse me, in the square, you should be seeing there's many more blue kind of faces, which are indicating that actually that risk is growing. And actually you can see now that risk has risen to 30%. So that patient has a 1 in 3 chance of having a heart attack nearly, or a stroke. We've taken the same patient and we've made him a smoker. So he smokes between 10 to 20 cigarettes a day. And you can see that his risk has gone up to 45%. That's nearly a 1 in 2 chance in the next 10 years of having a heart attack. So you can see what problems both diabetes and smoking cause significantly, and some of the other risk factors as well. So this person has pretty much a full house of everything. And then what we've done is I've just added in that family history. Okay, so this patient now is a 55-year-old male. He comes from Pakistan, he's Pakistani background, lives in Wembley, they smoke, they're a diabetic, they have high blood pressure, high cholesterol, and they have a first-degree relative who's had a heart attack under the age of 60, and you can see his risk is nearly up at 60%. So actually, he is more likely over the next 10 years to have a heart attack than actually not have a heart attack. And obviously that's quite concerning. So I guess the question then is, what can you do? So the first thing that I would say is control the risk factors. Okay, so diabetics are least at risk of having a heart attack when their diabetes is well controlled. Your patients with high blood pressure are least at risk when their blood pressure is controlled. The same with cholesterol. So either doing it through diet and exercise or taking tablets to help those things individually. So people might be on a cholesterol tablet or blood pressure tablets or tablets for diabetes. But the key thing is trying to get the risk down by controlling those as best we can. Okay. There's obviously things that you can't control, like as I said, the family history and your background and whether you're a male or a female and your age, you can't control those. But the other things you can. The other things you can do are trying to have a healthy diet, and that's a balanced diet. So, fruit and vegetables, and obviously with patients with diabetes, sometimes that can be a little bit tricky because some fruits can have high levels of sugar. So you want to choose the right types of fruits for those individuals. You want to have, leafy greens. You want to have good amounts of salad. You want to have good fiber in your diet, low fat, low salt. And when we say low salt for your blood pressure specifically, what we normally recommend is half a teaspoon in all foods per day. Now, I know that's quite difficult and isn't always kind of easy, but salt can, cutting down the salt can help and try and decrease can make it less likely for you to have a heart attack and actually help yourself kind of prevent yourself from having one. Alcohol. So alcohol is not a direct risk factor for having a heart attack or having heart disease, but we recommend kind of moderate alcohol. So within the guidelines, the national guidelines that the government recommends, that's what we would recommend. Doing regular exercise, so keeping yourself healthy, keeping yourself walking, doing exercise, and I know that's always difficult, especially kind of during the pandemic and being able to get out and do exercise, but it is really important for you to do that. And if you can do it, that will help. And if you obviously develop chest pain or breathing problems on exertion, then that's something that we would want to know about. Control your weight. So in each of these patients that I gave an example, I left their weight the same, which was normal. So they were of normal weight. But as you might know, that there is a high level of obesity in Asian populations and in Caucasian communities and African communities. And one of the things that we can do to help ourselves is try to specifically control your weight and maintain your height and weight ratio, or something called your BMI, or your basal metabolic index. And there is calculators on the NHS, and we're happy to kind of advise you of those. I think there's some on our website that you can actually check yourself, but hopefully that's something to do. And then the final thing is recognize the signs, and hopefully this kind of webinar has helped a little bit with that, and when to seek advice. And I would rather someone come to me 20 times and say I'm having chest pain than the one time that we actually miss it. And hopefully that has explained a few pointers. The one thing that I also wanted to hopefully indicate was that heart attacks now are not as, they are very, very serious, and they can cause damage to your heart. There is a chance of dying with a heart attack, but that is much less now than it was 20 years ago, when there's been newer developments in terms of heart disease and different things that can help patients who have had a heart attack. And that's developed over time, and that's a great thing, but it does still mean that you could be left with long-term problems if you do have a heart attack. Okay, that's the end of my presentation. I can't see any questions or any hands up, but if people would like to kind of put some hands up or put some questions in the chat, I'm very willing and happy to take questions and answer any questions that anyone has. I know that that's not the easiest of topics to understand and go through, but hopefully it's been helpful. But again, if you have questions, then please, you can either unmute yourself and ask the question, or raise your hand, or type in the chat.
Arun, can you hear me?
I can, yes.
Hi, it's Mrs. Trivedi Jayashree here.
Hi.
I found this webinar very useful. Thank you so much for organizing it. I just have a question. How would you recommend somebody at my age to have an ECG or NHS health check like you advised in your
in my presentation? Yeah, absolutely. So what I would normally say is we do often invite patients in to have these things. So if, for example, you are eligible, so if you don't have any long-term conditions, you are invited by the NHS once every 5 years.
Okay.
So once every 5 years, you will get an invite from us or the government to attend our clinic and get that. If I'm being honest, I'm very happy and open for anyone to come in and get an ECG and to get a blood test and check some of these things, and for us to kind of do those things in the practice. You know, I know that it's, for me, one of the things that I would love for us to be, and part of reason for doing these webinars is actually to educate you guys to hopefully be more preventative. And if we can be more preventative to prevent a heart attack, that's much better than actually treating you after you've had one. So from my perspective, I don't have a problem at all with you booking in for a blood test and getting an ECG. That's not a problem. We don't really refuse anyone. So if you wanted an ECG, a blood test, the ones that we would normally recommend are your sugar, so your HbA1c, or if you just say you wanted to check your sugar, your cholesterol, and your kidney function. And those three things will be able to put into a risk calculator and give your own personalized risk.
Okay, so but I had recently I had a blood test, so I can come and chat with you, and then you can guide me along.
Yeah, absolutely. So you probably would have already had those tests. So, you know, even if you wanted to drop the practice an email, we can send you your own personal kind of risk if you'd like, and if you wanted to, or you wanted to just book an appointment with myself or one of the other doctors, we would be happy to go over those things. It's not a problem.
Thank you so much. Thank you.
Pleasure. There's a few questions in the chat, so let me see if I can open that. Okay, so let's have a look. So is it advisable to keep 75 milligrams of aspirin and to give in the signs of a heart attack? So that's a really good question. So what we would say is that aspirin itself, we wouldn't normally recommend in advance of someone having heart disease. There's risks of taking any medication. So aspirin itself can cause, it thins the blood and actually can cause bleeding. So some people can actually bleed from their stomach or by taking aspirin. So it's not normal that we would do that. If you have the signs of a heart attack, and hopefully I try to educate you to say, if you're getting those things, you know, one of the key things is getting to hospital as soon as possible. So if for example, and one of the key things with a heart attack is if you're getting chest pain at rest and it's lasting a time period, the best thing to do is call 999. Okay, they can come within 8 minutes normally. I know COVID is slightly different and it's obviously kind of a bit more tricky. But if they get to you and you get to the hospital quickly, the hospital will give you the treatment, and actually that's the urgent thing of what you need. So if someone is having a heart attack, and what they would do is, let's say you went to hospital, they would give you some medication. They would do the ECG, so that's the electrical tracing of the heart, And then if you were found to be having a heart attack at that time, they would rush you to the to have an angiogram and actually unblock that artery. And that's the most important thing, rather than just taking 75 milligrams of aspirin. So hopefully that's answered the question. I'm happy to kind of clarify that some more if you wish. But I personally, the key thing for me is contacting us or a 999 as soon as possible. And again, the heart attack, you again, a good way to think about it is heart attacks normally occur at rest and they last for a slightly longer time period. But if you are getting chest pains, let's say, for example, if you have been having chest pains on walking, and then you've kind of ignored it, and then next week you start getting chest pains at rest, that's a time that we would want to know. Even if it lasts 2 minutes, we would want to know, and what we would do is refer you down to hospital that day, the same day as well. Okay. Does Middle Eastern also fall into the high risk category? And why does ethnicity play a role? Is it to do with diet or genetics? That's a really good question. Do Middle Eastern patients fall into the high risk category? Yes, they do. And I only gave 2 examples because otherwise I literally could give so many more. But they do fall into a high risk category. I think it's a combination of both genetics and diet. So I think there's a combination of both that actually cause the increase in risk. So unfortunately, there's a multiple number of factors that actually can cause that.
Hi, Dr. Arun.
Hi there.
Hi, it's Badrisa Kotecha.
Hi there.
Hi. At the moment, I am on blood thinning tablets, and I'm having like sometimes I have really bad headache in not in my forehead, but the front of my head.
Right.
And my ear, I get earaches as well.
What?
So,
but Badrisha, I mean, it doesn't sound like it's a heart problem per se. What I might suggest you do is, even if you call today, I know that we do have appointments today, and I'm sure one of the doctors would be able to kind of help kind of answer that question for you.
all right. Okay. No
Okay.
worries. Thank you,
All
doctor.
right. No problems. We have another question, and it says, can one have a check to check the condition of the arteries? So that's a really good question. So an ECG is one test that we can do. It doesn't, if you have a normal ECG, it doesn't necessarily rule out you have heart disease, but it does give an indication, okay? We normally go based on symptoms. So if you are having symptoms, then it's an indication to do a test. So we would often say from medical side, if you're not having symptoms, then it probably indicates that your arteries are fine. That's the likelihood. It doesn't necessarily mean absolutely, but that does generally, that's generally the case. So normally it would be based on symptoms first. So if you develop symptoms, or if you were ever uncertain of symptoms, and again, I would always stress, especially if you're a diabetic. So if you're a diabetic, it is one of those things that we do really recommend being extra careful and contacting us, just in case. If you're ever unsure, I would rather you contact us to then say, here's the symptoms I'm having, what do you think? And we would be happy to try and explain that. Okay. There's a question, can I access a recording from somewhere? Yes, you can. We'll be sending out the link to our patients, and it will be on our website, so you'll be able to do that. Okay, is there another question over there? Okay, there's a couple more questions on the chat, so I'll just carry on going through, and then perhaps if at the end, if someone wants to ask a question, they can just unmute themselves. How long can a clot on the heart take to dissolve if you are on warfarin? So that's a good question. It's slightly different than having a heart attack, and it would probably be related to a different condition called atrial fibrillation, but that dissolves relatively quickly. But once you're on warfarin and the warfarin is at a certain level and it's thinning the blood to half as thin or a third as thin as it normally is, it normally can do it relatively quickly. And actually, the earlier you can get on warfarin, the less chance you are of having any kind of complications. Okay. Next question we have is, would the signs of a heart attack be the same for someone without a gallbladder removed due to a liver transplant? So I would probably say yes. I would think that the generally diabetics will have more odd type symptoms than the classical ones, and sometimes classical and sometimes non-classical. The ones, so someone without a gallbladder, it shouldn't really have an effect. But if you're ever in doubt, then please ask. There's another question about the webinar, and we will be putting it up hopefully kind of by the end of the day, and then we were doing it. We've got another one saying, after listening to your presentation, I'm feeling at very high risk. So can I come and have a test? So yes, what I would probably do is, if you'd want to book in with me, I can perhaps kind of go through it with you over the phone first, and then we can kind of talk through it more, and then hopefully I can reassure you that despite you being at higher risk, there are things that you can definitely do to minimize your risk and decrease your risk. And often, you know, for me, what I don't want to do is make everyone super anxious or worried about this, but it's trying to give you the education to know, you know, unfortunately, there are things out of our control that we can never control, and there are things that we can control. And if we can control the ones that we can control, that's going to give us the best chances of, if you do get a heart attack, what to do at that time. And the earlier you get, the earlier you get treatment, the better is the best thing. But please, you know, please book in with me, or if you drop the practice an email, I can find time to call you, because at the moment I'm quite busy, unfortunately, with the COVID vaccine and trying to sort that out. So I'm seeing patients a little less, and we're trying to do some more of these webinars to hopefully help you whilst we're in lockdown. So if you wanted to drop the practice email, I'll find some time to have a chat with you individually. Okay, that is all the questions from the chat. Does anyone else have any other questions that they would like to ask? If you want, you can just unmute yourself. So there's the microphone symbol. If you click on that, you'll be able to unmute yourself. And do that. Or there's another one. There's a question saying, am I able to talk whilst having a heart attack? So it will vary on the severity of it, but often yes, you will be able to talk, but it's normally you will feel it as a pressure or a heaviness sometimes, as I mentioned, and but you will notice it doesn't feel right. You know, it's very rare that someone has. It can happen, but it's very rare that someone has no symptoms whatsoever and has a heart attack. So hopefully that makes sense. How am I supposed to alert my loved ones while having a heart attack? So probably, I think if you are having a heart attack, the key thing for me is one of the things that I would want you to do is call 999. That's the best thing that you can do, and that's the first thing that you can do. If you could dial 999, and honestly, when you get, that is the most important thing. And if you have family and friends or relatives kind of elsewhere, what I would want you to do is when you get to the hospital, they'll be able to help. But the key thing is you yourself getting treatment as soon as possible. Does anyone else have any other questions?
No, thank you so much, Dr. Arun.
Okay, pleasure. listen, hopefully you found kind of these sessions useful. I can see someone just typing, so hopefully there may be one more question. But we are doing more of these sessions kind of over the next few weeks, and we have sent out kind of questionnaires for topics that one might want. So there's some on high blood pressure, as well as asthma, as well as there's, you know, we can do women's health. We can do as much as you want, really, just to try and educate you on little topics that hopefully will give you that little bit extra of confidence to know how to manage these things and what to look out for going forward.
Thank you.
Pleasure, absolute pleasure. I hope you all stay safe and you know, take care of yourselves and each other, and hopefully the pandemic goes very quickly and we can all see each other very soon.
Thank you.
Okay.
Thank you so much. Have a good day.
Take care. Bye
Bye-bye.
Bye bye.
Bye.
Thank you.
Thank you. It was very useful.
My pleasure.